Hello, my name is Megan Anderson, and I am here today with Sahar Khan. We are two of the former Medical College of Wisconsin Emergency Medicine Program Chief Residents, and we're here to talk to you about wellness in our residency program through this presentation, Extinguish the Burnout. We have no financial disclosures for this presentation. The objectives of this PowerPoint are listed below. First, to define burnout and its implications in emergency medicine. Second, to describe wellness and the 7 dimensions of wellness. Third, identifying the importance of chiefs and the specific chief roles at the Medical College of Wisconsin Emergency Medicine Residency Program. And fourth, discussing and providing examples for how the Medical College of Wisconsin Emergency Medicine Residency Program impacts resident wellness through the 7 dimensions of wellness. Emergency medicine residency is a fast-paced, adrenaline-filled marathon of hands-on learning where physicians are forced to pivot minute to minute between the highs and lows of patient care. This environment lends itself to high levels of anxiety and concern for poor outcomes, which in turn influences the emotional exhaustion a physician may experience. In fact, a recent study described that EM physicians experience burnout rates greater than 70% when assessed using the Maslach burnout inventory. With this in mind, it's no wonder topics such as well-being, burnout, and mindfulness have been brought to the forefront of discussion among EM residency programs, especially since the residents have been found to be at a specifically increased risk for the development of burnout. Why is that, you may ask? Scheduling issues. Residents have little control over their schedule and are often required to work excessive hours, which may force residents to miss important life events as well. Oftentimes, the schedule changes on each rotation, making it difficult to have any consistency. Sleep schedule disturbances. Going along with scheduling issues, residents are often forced to juggle long days with studying and lecture time, which places a thorough night's sleep on the back burner, along with other healthy habits such as physical activity. A rotating schedule may also cause a resident to have an ever-changing bedtime, which can diminish sleep hygiene. Hierarchical impacts. Unfortunately, the medical training system is very hierarchical, progressing from medical student to resident to fellow to attending and so on. Because of this, residents find themselves feeling as if they are on the bottom of the totem pole and as if they have no autonomy in patient care early on in training. Occasionally, these hierarchies can also lead to toxic interactions and lend themselves to practices such as pimping, which ultimately can be a practice that is demeaning and can cause a resident to develop a lack of confidence, imposter syndrome if done poorly, and in many cases can lead directly to burnout. Excessive documentation. The bulk of chart review and EMR documentation responsibilities falls on the resident, along with a multitude of other tasks to complete during the day related to patient care. Occasionally, when there is too much work to complete during shift, some residents are forced to spend extra hours on their free time to complete this work. While this is the case, residents start to put other aspects of life on the back burner, such as physical activity, healthy eating, and spending time with friends and family, which inevitably will lead to burnout. Finally, lack of community. As previously mentioned, as a result of excess documentation, long work hours, and scheduling issues, residents sacrifice time spent with friends and family and co-residents. Additionally, many residents are attending residency in a location that is not near family or friends. With this lack of community, it can be easy for a resident to begin to feel alone and without support, again, leading to burnout. When thinking of the meaning of burnout, a few ideas come to mind for me. Exhaustion, depersonalization, imposter syndrome, feeling less accomplished, diminished physical health, poor mental health. However, burnout is not only exemplified in personal characteristics, it can be evident in interactions with patients and colleagues. Because of this, burnout can negatively impact the quality of patient care and therefore patient satisfaction, as well as patient safety. According to one study, physician burnout is not only associated with negative consequences for physicians, such as increased substance abuse and suicidality, it has also been proven to have a negative impact on patient outcomes and lends itself to increased risk of medical errors. So what is wellness? Wellness is more than just the absence of burnout or distress. It includes being challenged, thriving, and achieving success in various aspects of personal and professional life while encompassing emotional, physical, intellectual, and social components. Optimized wellness itself can improve energy levels, sleep hygiene, confidence, mood, and overall career satisfaction. Physicians strive to improve the health of their patients. However, physicians cannot effectively take care of others if not first taking care of themselves. Residency is a time where areas of wellness such as mental health and physical health are placed on the back burner due to time and energy limitations. However, even after residency, physicians do not always practice healthy habits in terms of health maintenance, exercise, nutrition, or sleep. This can be combated by addressing wellness during residency, since it appears that the habits and coping skills developed during this crucial time produce resilient residents and pave the way for both career longevity and professional satisfaction. In order to do this, many residency programs have implemented chief roles. In our emergency medicine residency program at the Medical College of Wisconsin, 4 PGY3 residents are selected to be chief. The 4 chief roles include Chief of Resident Education, Chief of Medical Student Education, Scheduling Chief, and Wellness Chief. Interestingly, not all programs have a wellness chief, or even a wellness committee, as my program does. I do firmly believe that multiple different aspects of wellness are addressed from all 4 of these chief roles, which we will discuss towards the end of this presentation. However, given the high rate of burnout in emergency medicine and the multiple aspects of wellness to address, I do feel the wellness chief role is one of importance. The 7 dimensions of wellness. Wellness is defined differently by everyone. While some people find wellness in physical activity or being outdoors, other residents may discover wellness reading a book for pleasure in a quiet space. Traditionally, there are 7 components of well-being: emotional, physical, intellectual, spiritual, social, occupational, and financial. As the wellness chief of my residency class last year and the inaugural Health Executive Administrative Leadership, or HEAL Fellow at Medical College of Wisconsin, my sort of niche is the combination of wellness and operations administration. In other words, making systematic changes in addition to new wellness initiatives to impact wellness. Larger impact from these systemic changes on individual wellness is seen from many studies. As wellness chief of the Medical College of Wisconsin Emergency Medicine Residency Program, I wanted to discover what wellness meant to each of our residents so that I could have a more effective impact on our residents' well-being. In order to assess components of wellness that our residents valued most, I created a survey for residents to complete at the beginning of the academic year. In response to these submissions, the Wellness Committee and I had been able to work on addressing the 7 dimensions of wellness through peer-guided suggestions. Over the next few slides, I'll delve into the details of how we were able to impact wellness through each of these 7 wellness categories at MCW. I will begin by discussing our program's contributions to intellectual wellness. Intellectual wellness refers to the desire to stay curious and engaged in learning new things and in creative activities. During residency, time can occasionally be limited to seek intellectual wellness outside of residency. Therefore, we attempt to provide emergency medicine-related intellectual wellness through a few different avenues. During my time as wellness chief, I developed a mentorship program where residents were matched with faculty based on personal and academic similarities revealed in a detailed survey. While residents were encouraged to seek out their own mentors or continue with mentorships already established, this allowed for close connections to be made to promote community as well as academic success, especially for residents who did not yet have a mentor. Another form of mentorship is developed through assigned assistant program director check-ins. Residents have a check-in with their specific APD every 6 months, allowing for continuity and the development of a trusting, comfortable relationship. Every year, the residents are given protective time off to attend the spring retreat, during which time a full brunch is paid for by the program, and residents are encouraged to provide feedback on the previous year of residency. Many changes to our residency have stemmed from these retreats, which has allowed residents to feel as if they have a say in making a change within our program. Annually, we also host a wellness-themed journal club. Similar to all of our journal clubs, this journal club is hosted at the house of one of the attendings with food and drinks provided. The topic discussed is wellness-related. An example of a topic from last year was burnout related to EMR use and note burden. Additionally, every year, the PGY2 and PGY3 residents attend a national conference, AAEM and SAEM. Funding for this is almost completely covered by the emergency medicine program, including registration fee, transportation, hotel, and a food stipend. Similarly, if a resident is selected to present research at a conference other than AAM and SAEM, the funding is covered. Finally, every year there are a few wellness-related presentations given at conference by faculty. This will be mentioned further in later slides. Next, I will discuss our approach to physical wellness. Physical wellness is described as body movement, eating well-balanced meals, good sleep hygiene, stress management, and receiving preventative medical care. At our program, we had a lot of fun developing new wellness initiatives based on physical activity and competitions. An example of this is our Blood, Sweat, and Beers competition, where residents and faculty are arranged into teams to see which team could earn the most points for physical activity over a 3-month span. The winning team was incentivized with a party at the end of the time frame, which was funded by our emergency medicine program. I collected survey data on this wellness initiative and found that overall well-being, energy levels, and sleep had statistically significant improvements after the initiation of Blood, Sweat, and Beers. This competition became so popular that it was made into a biannual competition. Our 4th round of this competition just ended in the winter of 2023. Sunday Fun Day is another new wellness initiative we developed during my chief year, where residents, faculty, nurses, techs, and even medical students were encouraged to join together at a specific Milwaukee trail once a month for a walk or a bike ride. Oftentimes people brought pets and other family members as well, and occasionally the group made a stop at the park's beer garden at the end of the walk. Physical wellness is also encouraged through providing free options for healthy meals both at weekly conference and in the resident lounge. There has also been talks of having a CSA, or community-supported agriculture, come to our conferences monthly to allow for easy access to fresh produce. Residents are also offered assistance in establishing a primary doctor at the start of residency. And finally, our program offers full reimbursement for Uber rides to residents who feel driving home would be unsafe due to fatigue. This can be especially important after long or overnight shifts. Social wellness involves having a strong social network that can provide community, support, and guidance. We have found many ways to incorporate this into our program. To begin residency on a good note with a high sense of community, we have Orientation Month for our interns. During this month, the interns have a few orientation-related lectures and are able to get their feet wet with a few clinical shifts and nursing shadow shifts as well to get used to the department. There is also an annual department-wide Brewers baseball game and a welcome picnic scheduled for this month. This month's schedule is purposely somewhat light so that the interns are given an opportunity to get to know each other as well as other residents and to explore Milwaukee while the weather is still nice. During Orientation Month, the interns are also assigned to houses, which consists of 4 separate groups of PGY 1 through PGY 3 residents. A handful of attendings volunteer to be the mentors or leads for each house. House groups get together a few times a year for fun activities in order to encourage fun interaction between residents of different levels and faculty. The houses are also how participants are separated for games at retreat and for Blood, Sweat, and Beers, so there's some friendly competition between the houses as well. Also, at the end of each year, points are counted for the different house-related activities throughout the year, and the house with the most points wins the House Cup. Another opportunity to encourage social interactions is our pre-interview dinners. Since in-person pre-interview dinners have gone by the wayside during COVID, our program encourages residents to get together to participate in the pre-interview Zoom session and offers to compensate for food bought for these get-togethers. Occasionally, we also have a cross-departmental event, which is grant-funded and encourages a social gathering between our program and another specialty. For example, last year we organized an axe throwing event between the EM residents and the surgery residents. Around the holiday season, our department celebrates a variety of holidays with a fancy department-wide holiday party and a journal club holiday party as well. We also arrange a Secret Santa gift exchange for the residents. As a result of some of the survey feedback I discussed earlier, it was also apparent that some residents experienced wellness through reading. Therefore, we developed a resident-run non-medical book club for everyone to participate in voluntarily. Not only does this encourage reading in those who find wellness through reading, it also encourages social interaction through the book discussion. Finally, every year we have a fall and spring retreat. As mentioned previously, the spring retreat is a time where residents have protected time off to join for brunch and discussions regarding the program. The fall retreat, on the other hand, has become one of the most popular social events of the year for both residents and faculty. For the fall retreat, the residents and a few attendings drive a few hours outside of Milwaukee for a night of camping, games, and competitions, team bonding, and team building. This is also completely funded by the program. Financial wellness refers to the ability to be educated about and live within one's financial means while planning for future financial health. In order to encourage financial wellness, our program has prioritized time for a few lectures throughout the academic year to focus on topics such as financial planning and disability insurance. Towards the end of residency, when the PGY3 residents are nearing graduation, they are also given lectures focused on financial wellness as an attending as well. A program also has a $500 book fund for each resident to utilize each year for study materials, in addition to the other previously mentioned reimbursements for national conferences, pre-interview dinners, etc. Finally, not only do we have high-quality insurance plans and a competitive salary, residents have the opportunity to be on the MICWA House Staff Wellness Committee, where the different topics such as retirement, family or sick leave, and other benefits are discussed to ensure the most optimal offerings for the residents. Spiritual wellness is the process of understanding beliefs, values, and ethics that help guide your life. This can be applicable to everyone, not just those practicing a specific religion. At MCW, we encourage spiritual wellness through a few avenues. First, we encourage acts of service or community volunteering through a few events throughout the year, including a backpack drive, winter coat drive, and packing lunches for a local women's and children's shelter. Acts of service are also encouraged between residents. For example, all residents are asked to fill out a survey about their favorite snacks or their Starbucks coffee order. Each resident has a copy of this snack list and therefore can surprise other residents with a treat on shift or when they are having a rough day. For residents who do practice a specific religion, they are able to make schedule requests, such as requesting off on a Sunday morning to attend church or requesting off for Eid, etc. This past year, a new wellness initiative was started by our program director, who purchased reflection notebooks for the residents. Residents were encouraged to decorate their notebook to match their personality. Occasionally during conference, residents are encouraged to take a few minutes to write in their reflection journal about a prompt or about 3 good things that may have happened. Finally, our program has had a lot of positive feedback regarding the pause since it was implemented a few years ago. The pause is a short paragraph of verbal reflection and silent pause that is attached to the resident, attending, or nurse badges to be read when a patient passes away in our care. The pause emphasizes that this patient is a human that is loved and that we did our best to take care of this patient. After a patient death or any difficult case, any staff involved is encouraged to utilize our respite room, which is a secluded, quiet, and peaceful space in the back of our department to reflect, pray, cry, or take a few moments to themselves. Emotional wellness is optimized by offering opportunities to improve mental health, as well as offering emotional support in difficult times or stressful situations. In order to encourage emotional wellness, we encourage mentorship not only between residents and faculty through our mentorship matching program, but also between residents with our Big SIB Little SIB program, where a PGY2 or PGY3 resident acts as a mentor to a new intern as they are beginning their residency. Oftentimes, these mentorships turn into close friendships between residents of different levels. Medical College of Wisconsin also has had training therapy dogs that travel throughout the hospital. On a few occasions, we have been able to schedule them to make a stop by our weekly conference, which always seems to boost the mood. We also have a very strong peer support program called Supporting Our Staff, or SOS. Through this program, hospital staff are trained on how to recognize when a colleague may need emotional or mental support regarding a difficult case or patient death, and how to provide support for them during this time of need to combat second victim syndrome. There's also a spin-off group from SOS called Residents Supporting Residents, or RSR, which is composed of peer support trained residents who arrange events a few times a year for residents of any specialty to join together to discuss stressors or residency or difficult cases. Peer supporters are also trained to recognize when someone may need more mental health assistance than a peer supporter can provide, and can therefore refer people to our abundance of mental health resources. These resources include an employee assistance program and the Coping Clinic, which offers in-person support, as well as Silver Cloud, or the virtual coping clinic, which offers online support. All employees are allowed 5 free visits, and spouses and children are also able to utilize these resources. For any residents experiencing a mental health crisis or even a family death/emergency, our administrative team is generous in the support they provide, as well as the ability to allow this resident to take time off without having to worry about the stressors of residency as well. The final dimension of wellness is occupational wellness, or environmental wellness, which is improved by optimizing your global environment and personal surroundings both at home and at work. In my opinion, this may be one of the most important realms of impacting resident wellness, because changes made to the workplace environment and operations can have a huge impact on work satisfaction and therefore wellness. Because of this, our scheduling chief has had a huge impact on our wellness for residents. Dr. Khan will discuss this further in the next few slides. In addition to scheduling details, we are always looking for ways to improve departmental flow and patient encounters to positively impact the occupational wellness of the residents. In doing this, our nursing staff is excellent at ensuring the flow of the department is as fair as possible between all pods. In the past, the way our pods were designed, one pod received an excess amount of trauma patients, while another had an excess number of suspected COVID patients. Within the past few years, changes have been made to make the rooming process more universal for all pods. This has also allowed for a more diverse educational experience for the residents. Another way the residents' educational experience is optimized is through one-on-one shifts with an attending. Not only does this foster an opportunity to develop rapport with an attending or establish a mentorship, it also allows for judgment-free learning and autonomy, all of which positively impact occupational wellness. In addition to the impact of work schedule, workflow, autonomy, mentorship, and judgment-free learning, occupational wellness can be significantly impacted by the ability to have control and an impact in their role as a resident. For example, our chief residents are encouraged to attend our weekly operation meetings to provide their input from a resident perspective. Additionally, as stated previously, residents are encouraged to get involved with the MICWA community, such as Health Staff Wellness Committee and the Patient Safety Quality Improvement Committee. I personally felt that being involved in these types of committees allowed for my voice as a resident to be heard and a way for me to make a change in my occupational environment, not to mention an opportunity to network as well.
As introduced earlier, my name is Sahir Khan. I was the scheduling chief last year for the Department of Emergency Medicine residency program, and I stayed on as faculty to continue my work in the ED. As scheduling chief, I had a unique opportunity to create the schedule, but also to affect wellness in a positive way. As I'm sure everyone's aware, scheduling itself could be a whole separate discussion, especially in the realm of emergency medicine. Many studies show that scheduling plays the largest role in wellness, as time at work equates from time away from home, your life, and the things that you enjoy doing outside of work. There are multiple facets of scheduling that can be focused on in order to maximize wellness. The main categories that we're going to focus on are resident preferences or employee preferences, shift times, and backup call. The biggest thing to understand are the preferences of those who are working. A survey was sent out to residents at the beginning to assess what their preferences might be. This helped me understand if residents prefer chunking shifts together in order to have more days off in a row, days, PMs, and night preferences, and other specific scheduling ideals. For example, some residents liked being off on Sunday mornings for church. Other residents liked working either AMs or nights in order to spend time with their children, as working the PM shift makes it incredibly difficult to see your children. Also, this allowed residents a chance to express their preferences and see it on the schedule, which ultimately promoted their autonomy and ultimately their wellness. Here you can see we have a couple blurbs from the residents in regard to what their preferences might be. I went through this on a Google Doc. I kept track of it also on a Google Doc so that I could refer to it if I had any questions about little details here and there that could be adjusted in the schedule for our residents. The next thing to think about are shift times. One thing that's really unique about our program is how our shifts are staggered. We have multiple teams that work throughout the day: red, blue, green, and yellow. Red shifts start at 5 a.m., blue shifts start at 7 a.m., and then from there on, they're 8-hour shifts, so they're constantly staggered by 2 hours, and green opens at 9 a.m. Because of this, the end times are also staggered, which means that there are less disruptions during sign-out, because if a sick trauma or medical recess comes in, they usually go to the team that is not currently signing out. The idea behind this is that it doesn't interrupt sign out, but then also it hopefully helps residents as well as attendings leave work on time, since there is that inherent overlap in the schedule. The other thing to think about is circadian scheduling. This is something that has been known for quite some time in emergency medicine, so I don't think we need to dive too deeply into it, but ultimately it's the idea that you go from AMs to PMs to nights, and when you're coming off of nights, to give employees and residents enough time to go back to their normal schedule, and then B, making sure that when they do come back, it's not necessarily to a day shift, it's to a later PM shift. The other unique thing that we were able to do in our residency program was line up some of the shift end times. For example, we have a children's shift that ends at 9 p.m., our red PM shift ends at 9 p.m., as well as our green senior shift ends at 9 p.m. This allows all of the residents to get together after shift, as well as hopefully going out with the attending who's working on red, that can enjoy some much needed time to relax after a hectic shift, as well as just a time for camaraderie. Backup call as well as reading weeks are the last thing that I want to discuss in regard to scheduling in a residency program. We had the unique opportunity to create reading weeks to help facilitate and cover our backup schedule last year due to the fact that we had additional residents since our classes grew in size. The idea behind this was that we need a backup call system in general, particularly after COVID. And having a backup call system alleviates a lot of the stress when it comes to being scheduling chief, but also as residents, because you know when things need to be covered. The reading week was this idea that basically each EM2 and EM3 was able to cover 1 week of backup during the academic year. This made my life easier as scheduling chief because I was very easily able to cover each month in terms of backup without having to piecemeal things together. And it also was really helpful for the EM2s and EM3s that were on this backup week because on average they were only activated 1 out of 7 shifts during the entire week. So ultimately this allowed them to focus on many things, including administrative tasks, wellness items, and personal tasks. A lot of residents really enjoyed the backup week. They were able to catch up on life things, sleep, laundry, grocery shopping. Being activated only 1 time out of 7 shifts during a week ultimately then results in just a much needed break from the hectic lifestyle that is emergency medicine.
In addition to the impact made by our wellness chief and scheduling chief, the chief of resident education also has an opportunity to affect the wellness of our residents. A few of the items on the list are repeated from earlier in the presentation, but included here to emphasize how the chief of resident education can impact resident wellness as well. Many programs, including ours, have protected time for conference, where residents are able to take a step away from the clinical side of medicine and patient care to learn and interact with co-residents and even attendings. A few times during the year, we also have wellness-related topics presented at conference. For example, we have recently had discussions and presentations on preventing burnout, nocturnist approach to wellness, financial wellness, and during Suicide Awareness Month, we always have a dedicated presentation on physician suicide as well. Additionally, we have trialed group therapy sessions for each class during conference, utilizing our psychiatry colleagues to provide helpful insight and therapeutic healing for our residents who are exposed to traumatic cases and both mental and physical exhaustion regularly. As many programs do, we have regular M&M presentations to discuss difficult cases. Prior to presenting these cases, an announcement is made to remind the audience that this is a judgment-free zone and a learning environment in order to create the safe space to discuss potential mistakes. Occasionally, we also take time during conference for personal reflection. All residents are given a reflection notebook and are given an opportunity throughout the year to journal in this notebook, reflect on 3 good things, or respond to prompts discussed during conference. One of our newer and well-received wellness initiatives is our Applause Awards. Once a month, the wellness chief takes 5 minutes during conference to publicly applaud residents for their hard work and good deeds. Applause Awards are submitted by co-residents, faculty, or nursing staff to recognize specific residents. Finally, 2 of the extra benefits of coming to conference is that there is always free food and coffee and occasional visits from our therapy dogs. Finally, we can discuss the impact that a chief of medical student education is able to have on wellness of a program as well. While this chief role deals mainly with interactions with our rotating medical students, there are a few ways that they are able to impact the wellness of these students who benefit from wellness as well. First of all, our rotating medical students are highly integrated into our residency schedule during their month with us. This does not just mean attending conference, though. The rotating medical students are also invited to our social events such as Journal Club and Sunday Fun Day, which allows them to feel like they are really part of the team. During shift, we try our best to encourage the medical students to have autonomy over their own patients and also do our best to provide them with an encouraging and safe learning space. This is important to not only foster confidence and learning, but to combat feelings of inadequacy and imposter syndrome, which is inevitable as the new learner on the team. Additionally, allowing students to feel that they have ownership over a patient and have made an impact on patient care has been shown to reduce burnout. As previously stated, we utilize a peer support system in our hospital to provide mental and emotional support for healthcare workers suffering from a difficult case or patient death. While the medical students are rotating through our emergency department, whether they know it or not, they are included in our peer support system. This means that anytime a difficult case occurs that a medical student was involved in, someone reaches out to the medical student to check in and offer resources. Many students have been very appreciative of this, especially since they see many traumatic and difficult cases in our emergency department, and oftentimes this is their first experience with death, penetrating trauma, or severe illness. This can be shocking for these medical students, and therefore it's important that they are aware of the support that they have. These are our references. And for any further questions or comments, feel free to contact either myself, Megan Anderson, Sahar Khan, or Nancy Jacobson. Thank you.